Hi, my name is Kemba Gosier, and I'm not a celebrity, nor am I a famous person. But what I am is a mother of a daughter with sickle cell anemia. When my daughter was born, I had never heard of sickle cell anemia. I didn't know what it was, what it entailed. I didn't know anyone personally with it, and I did not know that I was a carrier of the sickle cell trait. So many of us aren't aware that sickle cell disease is the most common genetic disorder in the United States. 1910 is regarded as the year of the discovery of sickle cell disease, making 2010 the 100th anniversary of that discovery. However, here it is over 100 years later, and it's so very sad to say that we have not come very far in terms of education, research, treatment, and awareness. So I decided to do a documentary, if you will, entitled The Diary of the Sickle Cell Journey, from the patient's and family perspective. I hope that this video can be an inspiration, educational, bring about awareness, and the push for change in the sickle cell community. Thank you. Sickle cell disease is an inherited blood disorder. Sickle cell is not contagious. It does not affect intelligence. People with sickle cell trait will never develop the disease. However, they carry a gene that could affect their children. So I'm using this diagram as an example to give you a better idea of what actual sickle cell looks like. As you can see here, this is a sickle cell. It's shaped more like a half moon, a banana. And here on this side, you see a normal red blood cell, which is circular, round, and smooth. So I want to do this brief demonstration to give you a better concept of sickle cell and how it works within the body. These red beads represent normal red blood cells. And as you can see, they flow within this bottle with no problem. They're not obstructed or anything. They flow with absolutely no problem at all. So this next example that I'm going to show you is demonstrating how sickle cells flow within the body. Notice how the sickle cells are clumped together and they're getting stuck. They're not flowing smooth and freely as the normal red blood cells were. And what happens is when those cells get clumped like that, they deprive what area that they're clumped like that in of oxygen, leading to extreme severe pain called the vaso-occlusive crisis. This pain can last for days, weeks, months, and some sickle cell patients suffer from chronic pain daily, like my daughter. It can also lead to tissue damage, bone loss, and organ failure. This is what happened to my daughter at the age of 11. She lost her right hip due to avascular necrosis, which is basically bone loss due to sickle cell. People with sickle cell can also develop a lot of complications such as infections, leg ulcers. Men and boys with sickle cell can develop something called priapism, which is an extended painful erection when the sickle cells gather in the reproductive organ. And as you notice, if you know someone with sickle cell, you may have seen that their eyes tend to be yellow sometimes. That's called jaundice. I bet you didn't know that there was also more than one form of sickle cell. The more common forms are hemoglobin SC disease, sickle beta thalassemia, and hemoglobin SS, which is what my daughter has, and is usually the most severe form of the disease. So who does sickle cell disease affect? Sickle cell disease is often thought of as a disease affecting blacks. And yes, a large percentage of the sickle cell demographic is black. However, people of many ethnic groups can have sickle cell trait or disease. People of Indian, Middle Eastern, Hispanic, and Mediterranean heritage. Even those whose ancestry is from Greece, Western Asia, and also Native Americans are also affected. Actually, tests for sickle cell trait are currently performed on all newborns in the United States. And even all athletes at Division I and Division II schools are required to be tested for the trait or sign a written release declining the test before competing. This is to make coaches and athletic trainers aware that some athletes may need to take precaution. Currently, the only treatments for sickle cell patients is a chemotherapy drug called hydroxyurea, which comes with risks, or a stem cell or bone marrow transplant, which also comes with risks, and you also have to find a donor that matches, which can be difficult, if not nearly impossible for a lot of people. And this has to change. Get out there in your community. Get educated. It is my hope that I have enlightened you on sickle cell disease and my documentary series. I encourage you to become sickle smart. Know your sickle status. Each pregnancy has a 25% chance that the child will have the actual disease if 2 people have the sickle cell trait. So help us to break the sickle cycle. You can get tested at your family physician's office, or you can inquire at your local sickle cell foundation. The test is absolutely free. Thank you.